Hi, I'm Dr. Tom Babu. I'm an endocrinologist by profession. I work at Silverline Hospital, Kadavadra. Let me just first tell you what endocrinology is, and then I'll take you down my memory lane. Endocrinology is a branch that specializes in treating hormonal disorders. Hormonal disorders are mainly diabetes, because diabetes occurs because of the disorder of the main endocrine gland called the pancreas. Then you have the thyroid gland, the dysfunction of which can create a lot of problems, and it is also a very common problem in the society. Then of course you have rare or not so rare endocrine problems in women and men. So all these things are treated by us endocrinologists. So having said that, let me just take you down my memory lane. If you ask me what motivated me to become a doctor, I guess, right from school days, my parents must have instilled these thoughts into my mind that, I may be my personality is such that I would be able to serve people more. So with that thought, I formed this whole dream in my mind, which was to become a doctor. And I embarked on this journey, as a young chap out of school. So my MBBS days was in JSS Medical College. Was one of the best days of my life that I can look back to. Now, why do I say that? Is because, that was my formative years as a doctor, where I got to see the suffering and difficulties of patients, for the first time in my life, even though before joining the medical college. Why did I decide to become a doctor is often a question that I've been asking myself, and it's something that, I thought I'd share with you. It may have been my parents who had put this thought into my mind when I was a little boy at school, that my personality would suit a doctor's. They may have felt it right from when I was little. So then this idea formed in my mind, and I started perhaps dreaming. And this dream became a reality when I joined the medical college. And this was at JSS Medical College, Mysore. And this is where I first started being groomed as a doctor. And I started for the first time encountering what patients actually go through in their lives. And to my mind, this is the most important lives or most important period in a doctor's life, where they actually start forming an opinion about their profession and about how they perceive their patients, or how they react to their patients. And that happened to me because what I saw around me was a lot of suffering, a lot of poverty, a lot of sad people because of their disease states. And not only because of their disease states, these things put a huge strain on their resource system, their finances, etc. And that is when you start to actually, your heart starts to go out and say that, why don't we or why can't we do something more? And this is exactly what happened to me through those years that I spent in the medical college during my MBBS. And at that point, we also had some fantastic friends who we probably will remember for the rest of our lives, because that is when we learn things together about life. Because you see, when we spend time in a medical college, that is when we actually share a common environment, because we're all training to become doctors. And there are a lot of commonalities, because even the way ahead or the road ahead, we have a lot of commonality. So we tend to interact, and that bonding we tend to have for the rest of our lives. So having said that, few important things that we learn during the medical college days is, our approach to our patients. Also, more importantly, what is it that we like to do more as a doctor? Because this is when we actually see these diseases very closely. So, for example, some of us want to become physicians, some of us want to become surgeons, some of us want to become gynecologists, and so on and so forth. So, that was a very interesting part of my life in the medical college during my MBBS days. And then, for me, surgery was not it. Obviously, gynecology also was not in for me, and it was medicine. And I always felt that I would do well as a physician because I enjoyed interacting with people, enjoyed talking to them more, and I didn't enjoy surgery much. Neither did I enjoy gynecology. I wanted to become a physician, so I joined for my MD, and I did my MD in Chennai. Now, MD days was the next phase of my life, which opened my eyes out to a very narrow spectrum in medicine, which is being a physician. So, you don't operate, you don't do anything else, you treat patients with medicines. So, that is what physicians do. And I really embraced medicine because this is what I like to do, and I was often the best student during my MD days. My professors used to appreciate my passion for medicine and the way I looked at life, or the way I embraced medicine. So we used to have very interesting discussions in the subject and even otherwise, and I really enjoy those 3 years that I spent doing my MD. So even during that time, what does one see? You see a lot of diseases, a lot of unhappiness, a lot of pain among patients, and you just want to try and do everything as a human being, as a doctor, to try and change those things. So, and it was during that time I realized that the way the world is going, we are going into an era where we're going to have a lot of metabolic diseases as opposed to infectious diseases. So when I say metabolic diseases, it means diseases that arise out of lifestyle, like mainly diabetes, cholesterols, heart problems, and all these things are the future. And infectious diseases like tuberculosis, malaria, and all that are going to wane off because India is developing, and we are going to get into that developed country bandwagon, which will come with it these problems. And so then I put my eyes on endocrinology, and fortunately, I had the fortune of being or qualifying for becoming an endocrinologist. I spent 3 years of my life training in endocrinology. I did my super specialty training. I did my national board in endocrinology from Amrita Institute of Medical Sciences. And there again, the learning was fantastic, where I got to do, learn endocrinology, which was what my passion was, up close and personal, and also interact with some top brains in this particular field, and also had the fortune of being trained by one of the best teams in endocrinology in India and in the world even perhaps. So I learned a lot there. After that, I moved on in life. We set up this hospital called Silverline Hospital, which caters to largely one of the strongest endocrine departments in the state. And we're doing a lot of good work, is what I would say with all humility. But these things come from sheer passion with which we doctors, or I as a doctor, wanted to contribute to the field of endocrinology. But more importantly, to wipe away those tears, to lend a shoulder to somebody in pain, and in whatever way possible that we or I as a doctor has been entrusted with, in whatever way I can use this to improve the quality of my patients or to help them in whatever way possible. And this is my endeavor, always has been my endeavor, and always will be my endeavor in the rest of my professional life as far as I can see it. I learn a lot in life from the feedback I get from my patients, friends, etc. So, to point out a few instances about how patients have influenced me in the way I look at life is that a lot of patients tell me that, doctor, when we come to you and we interact with you, we feel half our problems are solved. And largely, I suppose, this reaction is because I tend to talk more with patients. I tend to engage more with patients because the point is that I would want them to feel comfortable with me to share things that they generally may not would like to share with doctors, because then it helps me treat them holistically. Otherwise, what will happen is that they will come to you and they will tell you only about what they think you can help them with, which may not, because they may be having a bigger problem which we may completely miss. So when you engage them a little more, it takes maybe 1 or 2 minutes of your time to just ask them questions beyond, let's say, if in my case, diabetes, thyroid, or obesity, or any of these problems. All it takes is ask them a little more about their family, or a little more about their maybe profession or business, or life in general, and then they start opening up. That 1 minute extra that you spend may make a big difference in terms of how you can actually treat these people, because they feel a little more comfortable with you and they let you into their lives, and then that makes a big difference to both your quality of care and also their comfort zone. And I think, in my view, this is my personal view, it makes a big difference. Then the other thing that I always make it a point to do is, while going with my team for rounds every day, I make it a point to touch my patient, because I think patients long for that touch, to say that you'll be fine. A doctor just touching them, examining them, maybe with a stethoscope, or maybe with just a touch, telling them, look, we're trying our best, you will be okay, this is just a bad patch that you're going through, but it's going to be over soon, we are doing the best. And I think that simple gesture goes a long way in terms of the confidence that the doctor has in you. So I think these are the few things that emotionally charges you up, makes you want to do more and more, or keeps you going. Then often, we are faced with the situation where patients are, for some reason, overwhelmed with my maybe a personality or me as an individual, and they bring gifts. No matter how much you tell them, see, please don't do this, you're embarrassing us and all that, but they keep telling us that, look, nobody should refuse a gift, and we are caught between devil and deep sea, that now you accept a gift and then it takes away that patient-doctor relationship, but at the same time you can't refuse, because they come with so much of happiness, and so when you decline that gift, then they feel kind of all worked up and all that. So these are the times, not because they bring gifts, but it's just that the fact that they're very happy with you, evoking such a reaction or response in them wanting to bring you gifts, that itself gives you such a huge advantage to those passions that you have, and you just want to keep going. So these are small situations which charge you up, but at the same time, we have equal number of situations which pull you down also, because you have situations which are way too overwhelming, these diseases that you can't do anything about. You lose patients to the disease, you lose patients to the situation, You have a whole lot of complicated situations, and then those are the times when you feel really down. But I suppose life is ups and downs. You have so many, for every low you have a high, is what I believe. So, altogether, life is, I'm sure this is the case with anybody in life, it is a mixed bag. For every lows, we look forward to a high, and that's the way it goes. An important part in a doctor's life is his family. Because if he has a caring family at home, then he gets to do his work diligently, gets to work for his patients efficiently. I've been blessed with a wonderful family. My wife Bindu, she also takes care of she's the chief executive officer of the hospital that I work in. I have two lovely kids. Tia, she's 9 years. She studies in class 4. And I have a naughty son. His name is Joe Storm. He studies in the 3rd standard. And the only thing that I do apart from my profession is spend time with my family. So I look forward to spending equal time or quality time with my family. I prefer to organize my life in such a way that as much passion that I have for my profession, I try to plan such a way that I also give enough time to my family, because they don't get left out. And I'm sure that if my family does not support me in my career, by just being there, by supporting me in what I wish to do, I would not be able to do my work efficiently. So I depend on them for that understanding, for encouragement, and I draw energy from them every day, because I think that's what keeps me going. Also, I like to spend time at home because I have some pets. I have a dog, and I'm generally, I like to also give or like I would like to share my affection and emotion with patients, with family. I also have some left for pets. So that's something that we do as a family a lot. We spend time together. We like to play with our pets. I look forward to that time, and I like to do more and more of it, side by side with patient care. Looking back at my life, it's been one hell of a journey, and I'm the one to believe that I was destined to do what I do, which is endocrinology. And if it was not for this, I don't know if I could have done anything else. And I don't know if I would have wanted to do anything else, because I really I consider myself fortunate to have been picked by God to do God's work. And I enjoy every minute of my life, be it in my profession or be it with my family. I wouldn't have wished for anything more. Also, I think what makes my life complete is my patients who help me, who holds a mirror up to me and makes those changes in my life wherever it needs to be. And if at times I become egoistic or if I become selfish, my patients immediately hold that mirror up to me, and I know that I'm going in a wrong direction, and I'm able to correct those mistakes. Then another set of people is my family, who always wants me to become a better doctor, a better person, and they are another set of people who hold up another mirror in front of me. So I look up to all these mirrors or all these important people in my life to show me the way forward.